Here we have some old kimchi jjigae. It's basically a stew with like kimchi and pork, and that's basically it. It is still like 11:30, so maybe a bit of a weird time to be eating this, but that was the post. If I'm not wearing pajamas, I need to take a second to like just appreciate things. This is a rare occurrence. So I've got placement now. It's really snowing quite a lot, so probably gonna freeze, but I don't know, I feel like I'm kind of in Hogwarts. I don't know why. Why does snow make me think of Hogwarts? Well, that's what I feel like. I'm currently on my sexual health placement, so I'm going to a clinic from 1 till 5. And then I have an intensive care shift, which I'll talk about in a bit, because I don't want to get run over. I just finished my shift and I found the junior doctor's hub. It's literally just a room with a sofa. I just feel like this is my future, just doing like night shifts as a junior doctor and sleeping on a sofa. Anyway, I'm gonna go home. Okay, it's the next day. So in January, with this sort of new peak in COVID cases, my medical school's asking for med students to volunteer. We are getting paid for this, but I guess it's volunteer as in like volunteer your time on top of your placement. So at first I couldn't do anything because I had COVID. Whenever the medical school would send an email, and they were sending quite a lot, I think they were very, and still are very like stretched for ITU staff, just to help the ITU nurses. Whenever they would send an email, I would just get this horrible feeling of guilt because I wasn't helping. Just felt very, very guilty actually. So as soon as I started to feel better, I made sure I was starting these ITU shifts. So you can basically do day shifts, which is 8 till 5. You can do an evening shift, which is what I did yesterday, and today, which is 5 till 10. And then you can do a night shift, which is 8 till 8, which sounds very difficult. I'm doing things that help the nurses. So like taking the patient's observations, which is like the heart rate, their oxygen saturations, and just things like that. And I think it's just making their lives a bit easier because they were very stretched. So that's kind of what I'm doing, and I do feel way less, I don't feel guilty now because I feel like I've actually done something. If I'm just gonna be at home like on my computer or watching TV or reading a book or just doing something when there is like an ITU full of very sick people and not enough staff, how can I not feel guilty about that? That's so terrible, like not doing anything. And I don't live with any family members, like I live alone. I'm like relatively young and healthy, so I just think like how can I not do something? Also, I'm not saying that I'm doing anything amazing. I'm doing a fraction of what nurses and doctors and pharmacists and everyone else has been doing for like months and months and months. So I don't want praise. I don't need praise. I don't know, in the UK, like, people are very, and I guess in a lot of countries, people are very angry about lockdowns and people are very angry about COVID. Like, there's this girl on my Instagram who, she just says the worst things. And I just wonder, like, if she went to an intensive care unit and saw what was happening, then she wouldn't be able to, like, she wouldn't be able to have these beliefs that COVID is just not happening. Or that it's just a flu. I read this like article written by a doctor, and one thing that she talked about is how patients, like, they don't get to see anyone's face in real life as soon as they're in hospital now, because we all have to wear like this very full set of PPE. I don't know, it's really not good. It's not nice. It's horrible to be ill in hospital. It's absolutely horrible.